How to insert an indwelling urinary catheter. Best practices and principles for the prevention of catheter-associated urinary tract infections, also known as CAUTI. Prepare the catheterization trolley outside of the patient zone. First, perform hand hygiene using an alcohol-based rub or soap and water if your hands are visibly dirty. Clean your trolley's surfaces with clean, warm water and detergent. Then disinfect using an alcohol wipe. Allow it to dry. Gather these materials and equipment to prepare the trolley. A clinical waste bag. An appropriately sized sterile catheter. 2 pairs of appropriately sized sterile gloves. A sterile pack containing a gallipot, cotton balls, forceps, a kidney tray, 2 sterile drapes and 1 sterile fenestrated drape. A sachet of single-use, sterile, normal saline solution. A syringe containing 10 ml of sterile water. A syringe containing single-use sterile anesthetic lubricant. Hypoallergenic tape or a leg strap to secure the catheter. A drainage bag. A sterile specimen container if a urine sample is required. A disposable plastic apron. If you have a pre-made catheterization pack, study the contents list and collect any missing items. Place all items unopened on the lower shelf of the trolley and proceed to the patient zone. The preparation steps for female and male patients are identical. At this stage, ideally, ultrasound will already have taken place to check for the presence of urine in the bladder and the need for catheterization. Introduce yourself to the patient and explain the details of the procedure. Confirm their identity and consent and discuss any concerns that they may have. It is important to maintain the patient's privacy. If a single room is not available, then use a screen or draw curtains around the bed. Attach the clinical waste bag to the trolley and put on the apron. Open the outer cover of the sterile pack and slide the contents onto the top shelf of the trolley. The pack is enclosed in a sterile wrapping. By pinching only at the corners, unfold this wrapping to create a sterile field. Open all items of equipment using non-touch technique. This means that to maintain a sterile field, you must only touch the outside of the packs and not the sterile parts. Drop the items from their packs onto the sterile field without touching their contents. Dispose of packaging according to your local policy. Perform hand hygiene with alcohol-based hand rub and put on the sterile gloves. Pour the sterile normal saline from the single-use sachet into the gallipot. Place a sterile drape under the patient's buttocks and the fenestrated drape over their genital area. Ensure your patient is comfortable and examine the genital area to identify the urethral meatus. The adult female urethral meatus is an ovoid opening situated below the clitoris and above the vaginal orifice. Use of additional light may be beneficial to aid visualization during the entire catheterization procedure. Spread the labia majora and labia minora to help locate the urethra. The hand you have used to do this will no longer be sterile. Using forceps in your other hand, clean the urethra with sterile normal saline and a sterile cotton ball. Clean downwards in a single motion on the left side of the genital area, discarding the cotton ball afterwards. Repeat this action on the right-hand side of the genital area and in the middle. Finally, clean in a circular motion around the urethra. Use a new cotton ball for each section of cleaning. Do not use an antiseptic, as there is no evidence it will have any benefit at this stage. Dispose of your gloves and perform hand hygiene, as there has been a body fluid exposure risk. Put on a new pair of sterile gloves, as you will be performing a new clean or aseptic task. Use sterile gel to lubricate the tip of the catheter. Insert it into the urethral orifice and advance gently. Only touch the plastic wrapping of the catheter tubing as you advance it. If the catheter accidentally touches the vagina or the tip becomes contaminated, discard it and use a new one. Once the catheter has entered the bladder, the urine will begin to flow. At this point, continue to advance for around 5 centimeters. Allow any urine to leak into the kidney tray. Using non-touch technique, inflate the balloon of the catheter with 10 ml of sterile water, following the manufacturer's instructions. Never use air to inflate the balloon, as the catheter will float in the bladder and cause leakage of urine. Do not touch the part of the syringe that enters the catheter, or the part of the catheter tubing that enters the syringe. Gently pull the catheter back until the retention balloon touches the bladder wall. Connect it to the drainage bag using non-touch technique. Finally, secure the catheter by taping it to the inner thigh. The male urethra is longer and more curved, so care must be taken to ensure effective and comfortable insertion for the patient. Having completed your preparation steps, ensure the patient is comfortable and grasp the shaft of the penis. If the patient is uncircumcised, retract the foreskin. Using forceps, clean the urethra in a circular motion with cotton balls soaked in sterile saline solution. Apply 10 ml of sterile lidocaine lubricant gel from a syringe into the urethra and hold the penis for around 5 minutes to allow the anesthetic to take effect. Dispose of your gloves and perform hand hygiene, as there has been a body fluid exposure risk. Put on a new pair of sterile gloves, as you will be performing a new aseptic task. With one hand, hold the penis firmly behind the glans and raise it until it is almost totally extended. Keep the penis upright and perpendicular to the body throughout the insertion procedure. Using non-touch technique, only touching the plastic wrapping, insert the tip of the catheter into the urethra and advance slowly. You may encounter some resistance, particularly when you reach the bladder, but never use force, as this will cause trauma. Asking the patient to take a deep breath will help them to relax. If you feel resistance at the external sphincter of the urethra, grip the penis slightly more firmly and apply steady, gentle pressure on the catheter. Ask the patient to gently cough to ease the progress of the catheter. Then continue to gently insert until urine is flowing. Once the catheter is fully inserted, inflate the balloon with 10 ml of sterile water following the manufacturer's instructions. Then, very gently, pull it back until the retention balloon touches the bladder wall. Connect the catheter to the drainage bag using non-touch technique and secure it by taping to the patient's inner thigh. Dispose of your gloves. Dispose of all remaining materials and equipment in your clinical waste bag. And seal. Wash your hands with soap and water, as there has been a body fluid exposure risk. Hang the drainage bag using a urinary stand or by placing on the side of the bed. Ensure it is below the level of the bladder to prevent backflow of urine. Never leave drainage bags on the floor, as this can contaminate the urinary drainage tap. Help the patient to replace their clothing and encourage them to report any discomfort or complications that may develop. Record information about the catheterization in the patient's medical notes, including indication, date and time of insertion, and the type of catheter used. Leave the patient zone along with your trolley. Place the bag of clinical waste in the appropriate bin and clean the trolley. Finally, perform hand hygiene as you have touched the patient. Following the important steps you have seen will help to minimize the risk of CAUTI.